Hi there, I'm Dr. Mahesan, a medical practitioner for more than 28 years in the private practice. I'm associated with the Clinic Alumni Group, and today I would like to highlight onto you the common problems that many of my patients face from various illnesses. Basically, I found that people today, in spite of leading a life, seeking a life of quality, happiness, and good health, are unable to reach that lifestyle that they want. Why is it this so? It's because there are numerous factors involved in the welfare and health status of an individual. As a medical doctor, I've been impressed with one particular company that I found to be very effective in curing most of the numerous non-communicable or chronic diseases that are faced by my patients. For example, today we know diseases are affecting everybody because why? The basic fundamental root cause is that of poor circulation. As a medical doctor, let me put it in simple words. What is this circulation all about? We do have a heart, we all know that, and the heart pumps day in, day out, and it needs the combination of both blood vessels taking blood away from the heart to various organs of the body and back to the heart from these organs. These are known as arteries and veins respectively. But communicating between these two channels of distribution of blood is another circulation that is called microcirculation. What is microcirculation all about? Microcirculation is basically the circulation that happens in a pool of capillaries, tiny blood vessels less than a diameter between 6 microns to 12 microns. Because of this poor circulation at the capillary level, we find major organs of body from the heart, the eyes, the kidneys, the liver, and many other organs, including the endocrine organs, fail to get sufficient nutrition and blood supply from these capillaries. An example is the root of a tree. Only when the roots of the tree are watered directly rather than to the fruits, the flowers, or the branches of the tree can we find the whole tree growing very healthy and producing beautiful flowers and delicious fruits. Likewise, because of poor blood circulation at the capillary level, mind you, ladies and gentlemen, today we find people are suffering from hypertension, from coronary diseases and heart attacks, to stroke, to retinopathies, disease of the eye, to fatty liver, to kidney diseases, and to decreased immune system, leading to various types of cancer, obesity, and finally immunosuppression. What can be done about this? In spite of taking English medicine, or what we call hospital pharmaceutical medicines, we find patients with diabetes, with heart diseases, with cataracts, with kidney diseases are getting to go in for angiograms, putting in a stent, undergoing bypass surgery, and having blindness of the eye, cataracts of the eye, or diabetic patients where, in spite of taking English medicine, having their limbs amputated below the knee or sometimes the entire lower limb. Very sad. Why is it so? Why are patients going into kidney failure, ending up in dialysis and in end-stage kidney failure, or having to undergo kidney transplant? Why are young children today developing obesity and all? Basically, the fundamental problem is microcirculation. Not only that, there are many men shying away to discuss with the doctors or to share with their wives on the problem, perennial from time long, is erectile dysfunction. They're not able to have an erection, there's not a satisfying sexual relationship between the couple, they end up being depressed, they end up being divorced, or sometimes they fail to have children. Again, it's back to microcirculation. That's what is being beautifully said by scientists, that microcirculation is the second heart in the human body. Having said that, I have found in my quest, in my search for better improvement and treatment in the lives of my chronically ill patients, finally a solution. That is this wonderful product called Dentition Plus. Welcome again. I'm Dr. Mahesan, and today I'd like to highlight on two products. The main product that always have been a focus of attention and the buzzing, breakthrough technology in healthcare today is Dentition Plus. Dentition Plus, as I told you in my earlier talk, is that it basically comprises of 4 components, and it helps in the microcirculation, it helps in reducing the viscosity of blood, it improves the immune system, and more importantly, at each and every cell is enriched by Dentition Plus effective healthcare solution. There's another important equally herb that I would like to highlight today, and that's called Monascus. Why Monascus? Because today we are finding many patients being told by their doctors, by the healthcare providers, by lab technologies, you have high cholesterol. And the myth, what is the myth? The myth is saying cholesterol is bad for you, and because of high cholesterol you can get heart disease, and because of heart disease one can get complications of heart disease such as heart attack, blocked arteriovenous plaque, and what we call myocardial infarction or cardiac failure. What we have to understand when we say that cholesterol is an important risk factor in the cause of heart disease is that it is not cholesterol per se, but the oxidation of cholesterol. Now, before I go to the oxidation process of cholesterol, just let me tell you briefly about what's cholesterol. Cholesterol is a broad term given to a fat-like substance in the blood besides triglycerides. When we take in food, the food is broken down into glucose, amino acids, and fatty acids and glycerol from carbohydrates, proteins, and fats respectively. Cholesterol has got components. When we examine a patient's blood, checking for cholesterol or lipid profile they call it, we look at 4 important parameters: total cholesterol, high density lipoprotein or HDL, low density lipoprotein or LDL, and triglycerides. And finally, we look at the cholesterol glyceride ratio. This is how a healthcare practitioner or a doctor will come to a conclusion that whether a patient has got high cholesterol levels or not. Just because a patient has been told or diagnosed to have high cholesterol or hypercholesterolemia does not mean that he's going to die of heart disease. It simply means that the cholesterol level is high in the blood. What we have to focus on is, as I mentioned earlier, LDL. Now, LDL is supposed to be the bad cholesterol, and HDL is considered the good cholesterol. It's not so much as the bad cholesterol in your blood, but how fast this bad cholesterol is been broken down, or what we call oxidation. Just like you have an apple, you keep it out in the open air from the refrigerator. After a few days, it turns dark brown and turns eventually black in color. Why? Why is the fresh apple plucked from the tree or taken out of the refrigerator after a few hours turns this brown to dark brown to black color? Simply because the oxygen in the atmosphere with the negative radicals is causing these changes chemically. Biochemically, this fruit, apple, at the cell level, even though it has been plucked from the tree, is undergoing the degeneration process called oxidative stress. Likewise, in our body, the cholesterol over a long period of time taken externally through our food and by the production of the bile which contains cholesterol from the liver will cause this cholesterol level to elevate. And what is important, please mind this very carefully. I repeat, what is important is the oxidative stress or the oxidation changes taking place with the LDL. Many researches have been done on the effects of cholesterol in the human body, the HDL, LDL, and what happens when they feed on rats and rabbits, as well as when they add in certain types of lipid reducing agents, what we call statins. In that regard, most of the fats are classified into three: saturated fats, unsaturated fats, and trans fats. It's not so much the unsaturated fats, but it's the saturated and trans fats, and primarily it is the trans fats. Trans fats meaning those fats which are obtained from using the oil, heating it again and again, 5 to many times over. Very common in Malaysia with our pisang goreng, in fast food chains, McDonald's, French fries, and all kinds of food which is cooked in oil, the oil being used again and again. That's called trans fats. Or lard, pig's fat or bovine fat being added to margarine, called hydrogenated fat. In that regard, red palm oil is an excellent anti-cholesterol agent. It does not increase trans fats or saturated fats as the other products that I mentioned. So here is where we have one of Tasly's amazing product called Monascus. Whenever a doctor has diagnosed a patient having hypercholesterolemia or high cholesterol, they immediately recommend a drug called statin, anti-cholesterol tablets, in short, to reduce your cholesterol level. And these anti-cholesterol tablets, while they do reduce the overall cholesterol in the blood, they do not distinguish the bad cholesterol, good cholesterol. Not only that, they also affect the cholesterol that may be produced by the bile from the liver. So most patients, when are taking cholesterol, they have to take it to a minimum period of 3 months, and doctors stop them. Whenever such thing happens, there's a rebound phenomena. This very damaging to the liver cells called hepatocytes. They can develop liver problems, enlargement of the liver being one common cause called hepatomegaly. The other thing is that patient can also have other side effects such as nausea, meaning want to vomit, and some abdominal discomfort, bloating, bleaching, and so forth. In the case of Monascus, which is again a herbal formulation of lovastatin, 18 amino acids, flavins, and other many herbal preparations, helps in, first and foremost, particularly reducing the low density lipoprotein, helps in functioning effectively along with Dension Plus in reducing viscosity of the blood, improving the ejection diastolic fraction. That means the capacity for the heart to have more blood flow into its tissues or myocardium, and also in reducing the effects or side effects of coronary heart disease. Monascus also has another important component called red yeast rice, Horton. These are normal herbal preparations found in Monascus. Not all red yeast rice or Horton alone can do the job of reducing your cholesterol level. What can actually do is the synergistic effect of Dension Plus and Monascus put together, leading to the reducing of lipid in the body. When your cholesterol is reduced, you find that not only you're more energetic because the cardiac function improves, not only you don't have fatty liver as many people have because of too much of cholesterol, not only that, it also reduces the chances of atherosclerotic plaques being formed in the coronary vessels, and subsequently the formation of a clot or a thrombus leading to stroke and many other repercussions of impaired blood flow. Go for simple, less costly, highly effective natural remedies. And one such product, as I mentioned, is Monascus. When you take Monascus 2 tablets twice a day, either you can crush and eat them, or you can swallow them after your meal, preferably lunch and after dinner. Along with Dension Plus, in the morning 2 capsules, in the evening 2 capsules before meals, you will find that overall you have not to worry about having high cholesterol or the possibility of having heart disease. One thing is for sure, ladies and gentlemen, this combination has worked for thousands of people all over the world. So I can highly recommend to you without the least doubt that the usage of Monascus along with Dension Plus will be very effective in reducing your cholesterol levels. That means the oxidative process, the oxidative stress at the cell level, by improving microcirculation with the usage of Dension Plus. Thank you.